Good afternoon, everyone. We are here today at the Alberta Health Services base for HealthLink 811 calls in Calgary. For those of you who don't know me, I'm RJ Sigurdsson and the EMS Parliamentary Secretary. I'm pleased to welcome everyone, and I thank Alberta Health Services for hosting us today. Today I'm being joined by Minister of Health Jason Copping, Dr. John Cowell, Official Administrator for Alberta Health Services, and Dr. Francois Belanger, Vice President and Chief Medical Officer for Alberta Health Services. We're here today to provide an update on the work underway as a part of the Healthcare Action Plan to reduce emergency medical services response times. Before I invite the Minister to speak, I want to note that we are here at this available space that looks very much like the space registered nurses support 811 a couple floors away. We're doing so we do not interfere with HealthLink operations. We want to be respectful of those who are working and the Albertans who are trying to connect. And with that, Minister Copping.
Thanks so much, RJ. Good afternoon, everyone. Thank you so much for coming. It's great to be here today at the one of the HealthLink call centers based in Calgary, which, as MLA Sigurdsson mentioned, is in this building. As many of you know, registered nurses play an important role in providing care and guidance to Albertans in a wide range of settings, including 811. And today, I'm pleased to be here to announce the launch of the EMS 811 Shared Response Program, which gives EMS dispatchers the ability to transfer calls not requiring an ambulance response to 811. Now, before I share more, first, I want to sincerely thank all our emergency communication officers in dispatch centers across the province for literally answering the call of duty day after day. In many cases, they are the first person responding to a crisis. They work to support more than 1,000 Albertans a day on the other end of the line who are scared, in severe pain, or even worse. Their job is not easy. Call volumes are up 30% over the past 18 months. The significant increase in calls has also meant challenges finding available ambulances to send to emergencies quickly, which increases pressures on paramedics across our entire province. Now, many people are working hard to address the challenges in this process and make changes to ease the pressures on our frontline workers. As I've been saying, help is on the way. And I'm here to update you on our priority actions to bring down EMS response times through our Healthcare Action Plan. Stepping down non-urgent 911 calls to HealthLink, where clinically appropriate, began mid-January. This shared response between EMS and 811 will help make sure more ambulances are available to respond to urgent 911 calls sooner. Every minute counts for Albertans with a serious medical emergency, and providing dispatchers with the ability to assess a call and divert non-urgent issues to the dedicated team of experienced nurses at HealthLink is a win for Albertans. This change frees up paramedics to focus on life-threatening and urgent calls. Now, this has always been our top priority. Transferring calls to 811 will also help those who need support with non-urgent conditions but don't know what to do or where to turn. Callers who are transferred to HealthLink will speak with a registered nurse who will do a further assessment of the caller's situation. The nurse can then provide health advice and referrals as needed. Now, Dr. Cowell will share more details on what Albertans can expect when they call 911 for a medical situation. Now, stepping down these calls will mean freeing up ambulances and paramedics up to 40,000 calls a year where an ambulance response isn't required. That is significant. We've seen other jurisdictions like Nova Scotia and other areas in British Columbia, Ontario, and Quebec successfully move in this direction to deal with non-urgent calls. And this is just one of the priority actions underway to lower EMS response times. Other work includes fast-tracking transfers from paramedics to emergency departments to get ambulances back on the road sooner, and changing the way we handle low-acuity transfers between hospitals and facilities in Edmonton and in Calgary. Now, these particular changes will free ambulances from nearly 45,000 transfers that don't need an advanced level of care. And all of these actions will improve our healthcare system and speed up our EMS response times. Albertans deserve to get the best quality of care available. And we are determined to fix the healthcare system, and I will continue to provide regular updates on the progress of our healthcare action plan. So once again, thank you for watching, and I'd like to turn over to Dr. Cowell. Dr. Cowell?
Thank you, Minister. Well, from my point of view, this is a great day. This is one of the exciting initiatives that we're putting in place as part of the 4 priorities. And this is a particularly interesting one because it takes advantage of our skill set in both the EMS dispatch and our health resources over in 811. Bringing these 2 aspects of our Alberta Health Services together is going to result in something I think you're going to hear as very meaningful. So as I continue to provide you updates on the role that I've been assigned, improving EMS response times, decreasing emergency department wait times, reducing wait times for surgeries, and improving patient flow throughout the healthcare system, this excellent initiative is going to, touch on at least 2 out of those 4 very directly. So as the Minister and Mr. Sigurdsson have said, we're really pleased to announce this program, which actually started about 2 weeks ago. So we can really give you results already of what this is able to provide. The shared response is, as I say, a collaboration between these 2 parts of Alberta Health Services in a highly safe, high-quality, professional way that ensures that Albertans will get the care they need where and when they need it. So this is how it looks, and Dr. Belanger will follow up with even more details. When a 911 call comes to EMS, a trained emergency communications officer called a call evaluator will evaluate the call, and an ambulance is immediately dispatched as soon as they know the correct address. However, the evaluator continues to assess the caller. Callers who are assessed through this very careful objective process in EMS, who are assessed as not serious and not urgent and do not need an ambulance response, are then directly connected to our 811 registered nurse, the registered nurses in our 811 HealthLink Center. The ambulance response then is called off, and thus freeing up the ambulance to be available along with its crew for other emergencies. The HealthLink nurses use their genuinely powerful health experience to assess the caller's condition, just like they would for any other caller, and provide advice, guidance, and connection to appropriate care. By transferring these low acuity calls to 811, we will safely avoid unnecessary ambulance responses and ensure ambulances are available for emergencies. If during their assessment that they confirm that an ambulance should go, they have an immediate cross-link back to dispatch, and the ambulance will carry on and look after that patient. So we are seeing very, very positive early results, and Dr. Belanger will speak more specifically about that shortly. But just an early comment, already we're seeing 6% of our calls being transferred to 811, and you can imagine what a positive impact that's going to have on the more effective use of our ambulances, freeing them up for the calls that really demand their attention. In a word, patients are now getting the right care from the right provider, which means improved patient flow, which is another one of the areas that I'm interested in, with more appropriate, specific ambulance usage. So Dr. Belanger, who is our Chief Medical Officer, will come forward in a few minutes, and it was under his leadership that this very creative program really came into being. Also today, I would just like to comment on that we're launching a request for interest in the community for transporting patients who do not require emergency care between facilities. You might know it as interfacility transfers. Too often, our ambulances are used for patients that don't really require emergency care level in those trucks. So we want to have another tool at our disposal that's appropriate for the person in that transfer vehicle, but which does not tie up those ambulances we critically need to be available on the street. So that's just another tool that we are implementing quite quickly to ensure that our ambulance fleet is being used very effectively, so that it will, code reds will become a thing of the past, because we will always have enough ambulances ready. I suppose you already know, too, that some time ago it was decided that ambulances would not be dispatched to non-injury sites. In the past they would go, but now that doesn't happen. I guess the other thing I'd remind you of is that paramedics are now able to assess, treat, and refer patients that do not require transport to the hospital after they've been to the scene. They can arrive at a scene and they have direct contact with medical physician backup right there, and a decision could be made whether or not that transport really was necessary. So I'm supporting and accelerating all these actions, especially the two that I just spoke to today, and we're going to continue to provide regular updates whenever possible so that you are kept apprised of what we're doing. So at this point, I would like to invite Mr. Sigurdsson back to the podium.
Thank you, Dr. Cowell. Once again, good afternoon, everyone. I'm glad to be here today with a great team of registered nurses at HealthLink. I know most people don't get an opportunity to meet registered nurses with 811 or the emergency communications officers in 911, so I would like to extend a heartfelt thank you on behalf of all Albertans for your service, going above and beyond every day to help us, our loved ones, and our friends in our communities. I've had the pleasure to engage with emergency communications officers during my previous role as co-chair of the EMS Provincial Advisory Committee, and I continue to do so in my current role as Parliamentary Secretary of EMS Reform. I'm a believer in listening to staff on the ground. They know what's best, what's working, and what can be done better. They provided me with valuable insight and advice, and I'm committed to act on many of these solutions, and this commitment is part of the reason we are here today. One of the advisory committee recommendations was to explore ways to assist 911 callers with non-urgent health conditions. I'm pleased AHS has begun the joint EMS 811 approach. This change is about providing the appropriate level of care for Albertans where and when they need it. It gives dispatchers the ability to transfer calls to 811 and ease the strain on EMS workers. It will help paramedics focus their efforts on the most urgent calls, where their level and expertise of care is most needed. Our healthcare action plan is delivering on a promise to fix the emergency medical services and get ambulances to Albertans with serious medical emergencies sooner. We will continue to push ahead with actions that help strengthen our system, and we will do it together with our EMS partners. Thank you, and I will now turn it over to Dr. Francois Boulanger.
Thank you, and welcome everyone. I just want to offer my sincere appreciation and thank you to Dr. Cowell and also Minister Copping for their support for this initiative. As Dr. Cowell noted, we are taking action and making progress. EMS and 811 have worked together to implement EMS 811 shared response. Our EMS emergency communication officers are connecting low acuity EMS callers directly to HealthLink 811. HealthLink is providing further assessment of support with those calls. Since January 16th, EMS has assessed more than 1,000 calls as low acuity and connected them to 811. Just to give you an example of what the results are, amongst the patients who were assessed by HealthLink's registered nurses, 20% were advised they may care for themselves at home. 40% were advised to see primary care physician. Common concerns that we have seen referred to 811 from EMS include non-emergency events such as constipation, insomnia, or sleeplessness, or earaches. Approximately 80% of the calls sent to 811 were redirected by 811 back to EMS for clinical reasons. Another 28% of the calls redirected back to EMS were for other reasons, primarily a patient requiring transportation. EMS and HealthLink teams are actively collaborating and confident that return transfers will be further minimized in the future. To see more than 1,000 calls transferred to 811 to get help in another, more appropriate care environment is truly remarkable. This will have significant impact on our efforts to reduce EMS response time, reduce emergency department wait times, and improve patient flow through the health system. As our EMS and 811 teams grow more comfortable with the shared response and adjust and learn, we anticipate we will continue to see more calls diverted and more Albertans receiving the care they need from the most appropriate provider. We will also continue our efforts to educate Albertans about this process. We know and appreciate that the public also need reassurance that they will still get the help that they need when they need it. As Dr. Cowell also noted, we are going to also go to market with a procurement process. This procurement process is aimed at assessing qualification and interests of third parties who could provide paramedic transport care for inter-facility transports in place of our EMS ambulances. Responses will then be evaluated by an AHS team. We anticipate evaluation will be complete by early April 2023, and we will update on next steps at that time. I want to thank the fantastic EMS 811 contract procurement and supply management teams for their dedication, innovation, and passion. We're lucky to have them. These qualities have allowed excellent ideas to become a reality effectively, rapidly, and will benefit all Albertans. Thank you as well to Dr. Cowell and to the Minister for their support for their teams. We will now play for you a brief clip from a mock EMS 811 shared response call. This is not the full call, which is available by link in your news release. This clip of call illustrates the diligence and care of our teams and the type of call that is more appropriately managed by 811. Can we start the audio, please? I know this is also featured on your live feed. Thank you.
Ambulance dispatch for what town or city?
I have had a rash on my arm for the past 2 days.
Is your breathing normal for you?
Yes, it is.
Are you bleeding or vomiting blood?
No, nothing like that.
Okay, thank you for answering my questions. I am going to connect you with a registered nurse at HealthLink. Our initial assessment indicates that you do not need to go to hospital by ambulance right now.
HealthLink, Jasmine speaking. I'm a registered nurse. How may I help you? Instead of sending you to the emergency department by ambulance, I can refer you to the HealthLink's virtual medical referral program.
Concludes the formal portion of our avail. We'll go first to questions in the room. If you could state your name and outlet at the microphone. Go ahead.
Can you hear me okay? Oh, great. Alana Smith with the Globe and Mail. My question is for Minister Copping. I'm just wondering about children's acetaminophen. It looks like it's been approved from Atabay for the importation to Alberta pharmacies. So can you say how many bottles this is of the 4.75 million that are remaining, and then provide a status update for ibuprofen?
Yeah, so it was approved. The shipment was approved, like the remaining shipment is approved. My understanding is, but it's still subject to final approvals for the labels. So even though the dosage was approved and the overall shipment was approved, it hasn't been approved for shipment here to Alberta. So we're working with Health Canada for the labels get approved, and then we'll have a better timeline on how much acetaminophen, how much ibuprofen, all the details. We haven't got all that yet, so it's positive step forward. Like we got the dosage approved, but we still have a few more steps to get through before we can finalize all the questions and know what the timelines of it coming in. I am hopeful it is days, but I've been hopeful for a while, but yeah, I'm hopeful that it's days.
And sorry, so that's for acetaminophen and ibuprofen, or what are you?
I haven't got the detail on both of that yet. It's just my initial assessment that with staff is that it is for both, but we're not crystal clear on that yet. So we're actually working with Health Canada. We do know though that the labels still need to be approved, so it's not coming quite yet.
Okay, gotcha. And then, sorry, just my follow-up for that. I'm just wondering, at what point, are you worried that there's not going to be as much of a need or desire for these sort of medications to come to Alberta? Because it's been already 2 months since the original announcement.
Yeah, so we are on ongoing conversations with the pharmacy community. There still is a shortage here, so we are quite comfortable that for Alberta that we will still need the shipments, and again, the shelf life on this is 2 years, so it's not just about this season, it's about next season as well. In addition, we're continuing to work with other provinces should they have need, and we'll be able to share that as well.
Thanks very much. Next question.
Hi, Alyssa Carpenter, Global News. I'm just wondering, you mentioned that in the last 2 weeks, it's been about 1,000 calls that were able to be diverted to 811. I'm wondering, prior to the implementation of this, how often were ambulances being dispatched in this province that were not needed?
Yeah, so my understanding is that it would be a large percentage of that. Now, EMS crews still have the ability to make the call on whether they're going to bring someone in, but dispatch to it would have been nearly the full amount. But I'm going to ask actor Dr. Belanger to comment on that.
Yeah, so EMS always responds to request an ambulance. That was kind of the workflow that we had. Our modeling shows that we anticipate that low acuity calls will respond to approximately between 10 and 20%. So we're early days. We've done 2 weeks, and we anticipate that the number of units that we're going to be able to redeploy more effectively will be around 10%. That's where our goal is. Thank you.
But do we have modeling, or do we have the numbers that show, like prior to this, how often were we sending ambulances to non-emergency calls in which no patient ever needed to be transported?
Yeah, I think if you looked at kind of the experience of other jurisdictions, as I said, it's around between 10 and 20%. Yeah, thank you.
Right, do you have a follow-up?
I actually do. Is there any impact if we're diverting 1,000 calls, in this short period of time? Is there any impact on regular Albertans who just want to call 811? Will they see a delay in trying to get through if the EMS dispatch system is using those lines?
I'll start off the answer. So we do appreciate that this is going to actually put more pressure on 811. So resources are being added to 811, and including nurses. But I'm going to ask Patricia Chambers, who's to comment exactly on that, because she's in charge of 811. Trish.
Thank you. Yes, HealthLink was able to add some extra resources, and this shared response line doesn't actually impact the regular 811 line. These calls are coming from EMS over to 811 on a specific dedicated line, and those calls are going and being answered by our team of registered nurses. If we do send a call back to EMS, it as well is going on a different specific dedicated line, so it does not interfere with any other Albertan calling 811. Thank you.
Hi, this is Stephanie Thomas from CTV Calgary. I think my question is going to be for the Health Minister, Jason Copping. I'm wondering if there's going to be additional training for those call evaluators, just given that it seems like there's a lot more importance for them to be able to assess the severity of that call before they make that choice, whether it is moved on.
So the short answer is yes, but I am going to get Jim Garland, who's responsible for the 911, to actually talk about what specifically they're doing on that.
Yes, thanks for the question. We follow evidence-based protocols in evaluating 911 calls, and those evidence-based protocols are supported by an auditing process that's very robust and feeds our quality improvement program. So we continue to do that. As we use these protocols to identify low acuity calls, we continue to assess and make sure that the protocols are being followed and are compliant.
Again, I think my follow-up might be for Jason Copping, but for many Albertans who might have used 811, oftentimes the advice is to go see a physician or even go to the emergency department. So how can you ensure that there wouldn't be then a backlog at the ERs if that's going to be the direction of a 811 caller receiver?
So thanks for the question, and I've heard that before in terms of you call 811 and then they say, you know, go to the emergency department, and in certain cases that is appropriate. I am going to ask folks from 811 like Trish to actually comment on this again. As Dr. Belanger already indicated, the transfer from 911 to 811 they do in the assessment. Now there still is an opportunity that may actually go backwards. Now again, it's low acuity, right, at the end of the day, so it can go back the other way, and there's that flexibility there as you learn more throughout the process. But you know, in regards to 811 generally, they're improving that all the time, and then also there has been the addition of doctors being involved in that process as well to be able to do better triage and better assessment. You know, because we have great people working in the system with a huge amount of skill to be able to do the triage assessment, but sometimes they reach a point where they don't have that capability, and then they need someone else like a doctor to step in. So work is being done to actually improve that, and I do know that 811 is tracking that. But Trish, if I can ask you to comment on that, please.
Thank you. There's actually a number of different ways and services that HealthLink directs our callers to 811. It's actually less than 20% of those callers that actually do get directed to an emergency room. Now, with these additional calls coming from 911 over to 811, we're actually diverting callers away from the emergency room because many of these low acuity callers were headed to the emergency room to begin with. So having the caller speak with one of our registered nurses at HealthLink, we're able to assess them and assist them, sometimes with a referral to our virtual physician program, sometimes it's to other programs and services, and sometimes it's information just about the best way to care for themselves at home and what to watch for. Thank you.
All right, I think we can go to the phones. Operator can put through our first caller.
Dean Bennett, Canadian Press.
Oh, good afternoon. A question for Minister Copping, please. Minister, I wonder if you could help me out with something. You'll recall on the Premier's first day in office, she announced Hinshaw was out, and I will be guided by a team, I'll take public health advice from a team of scientific advisors. The Premier's office told me in a statement a month later that the Premier was working directly with you to assemble this team, and it would be ready by Christmas. That didn't happen. And last week, the Premier's office told me that actually the team's not coming together because we're going to take advice from Preston Manning, which would suggest we're getting medical scientific advice from Preston Manning. I'm not sure how that would work, but I guess my question is, what happened to the panel, sir?
Yeah. So as the Premier's office indicated to you, she has asked Preston Manning and to look at the Alberta government's response, and then how do we improve that going forward. So that work is being done, and as well as she has asked me in terms of my mandate letter and working with the HQCA to look at the data So assessment of the data that was used to be able to measure the impact on Alberta, and then how do we improve that going forward. So that is the work that is being done.
Yeah, I appreciate that, but that's not what you guys promised. You promised an ongoing panel of scientific and medical advisors. That is not happening. Why not, sir? So
that is not happening. What our focus is on doing an assessment for, as the Premier indicated, a panel led by Preston Manning to assess the what we did during the pandemic, and how do we, what tools that we need from a legislative standpoint, for example, in terms of how to better manage that going forward, and then taking a look at the data through the HQCA. So that's, the data in terms of the HQCA is in my mandate letter, and that's what I'm focused on as the Minister of Health.
Thank you very much. Operator, can you put through the next caller?
Catherine Kukowski, Alberta Today.
Hi, thanks for taking my question. I had, I guess, a couple questions about this 811 mechanism. I had thought that there was already that dedicated line where 811, if there was an emergency, could bump it to 911. I'm just wondering if that's the same line, and whether you're monitoring whether this new assessment process has increased the length of time dispatchers are on the phone to assess callers to determine whether 811 is more appropriate for them.
Yeah, so I'll let the experts speak on the 811 system and the 911 system in terms of the assessment. What I can say is, as part of this process, there is an availability. Like this, what's new is the ability to move from 911 to 811. And then, as part of that process, to move back. But in terms of whether that was there before, I'll ask Trish to comment on that. And then on the impact of the on EMS in terms of the dispatch time, I'll ask Jim to comment on that. So, Trish.
Thank you. HealthLink has always had the ability to move calls to 911 when appropriate. This is a new program, and this is actually a new dedicated line that has been added into HealthLink. So, again, somebody else calling 811 just themselves, and we're needing to transfer that call to 911. We always have had that ability. We still have that ability, but this is a new line. It's a new dedicated line that is between 811 and 911. Jim.
I think I understood the question. What's the impact to the call evaluation time for our 911 ECOs when going through this workflow? It hasn't changed. We're still using the same protocols to evaluate the caller's symptoms and complaints. And if it meets the criteria, then it's just moved over to our colleagues at HealthLink. And with the dedicated line, there's very little to no wait time.
Thanks, Catherine. Do you have a follow-up?
I do. So we've heard about this EMS, and we've also previously heard some updates on surgical wait times. But there were 4 goals in this healthcare action plan that were supposed to be reported on within 90 days. It's been more than 90 days. I'm wondering when we're going to hear an update on the decrease in emergency room wait times, as well as goal 4, the empower frontline workers to deliver healthcare.
I'm removing my mask because I choke a bit with it on. So, and I'm far enough away, so please don't worry. Yes, that's a great question, and the report is coming, I would say, within 2 weeks. We have it well in hand. We've been focused very hard on being able to share with you actual results, and that's what I would really like to be able to include in my report with you. So, yes, their 90-day report. I think I'm still within time on that. So our goal is to have it probably about the 2nd week or 3rd week of February.
Thank you very much. Operator, can you put through the next caller?
Lisa Johnson, Edmonton Journal.
Hi, thanks for taking my question. Just to follow up on what Catherine was asking, Dr. Cowell, you were appointed on November 17th. So I guess I'm wondering why you've shot so far past the original deadline of 90 days. Like, why has it taken longer than 90 days?
Now, am I adding correctly? 90 days is 3 months. So February 17th, January 17th, December 17th. I'm pretty close to the time, but we did not give you our 60-day, if you're thinking about that. We did miss that because we didn't feel we had enough to tell you. And,
okay.
And as I said before, it's coming within date. So, and I really want to, now I've been giving you sneak previews, of course, with the updates on, like for today is a form of update on our actions to reduce response times. And you also heard about the non-ambulance transfer, and you also heard about the bridge healing project, all of which combine to reduce ED flow time. And yeah, more coming. There's a lot of work going on, and I'm actually looking forward to the day when I can share all of the things that we're doing in a very, very professional, meaningful way so that you'll have lots of data and lots of narrative to work with. Coming soon.
Thank you. Do you have a follow-up?
Yeah, thank you. Sorry, thanks for clarifying. It was 60 days that was missed. I'm wondering, Premier Smith has previously promised that your position, this was before you were appointed, but your role would also include working with an independent body like the Alberta Health Quality Council to do a health facility audit, including providing recommendations for future action. And so I'm wondering if that audit is still being done, if it's been abandoned, and if Minister, perhaps you could tell me what guided the decision not to have the Health Quality Council involved in that specific piece.
I'm not sure I was directed to work directly with the Quality Council on that particular activity. We have an internal audit going on, looking very carefully at our bed capacity and our bed utilization as it relates to patient flow and access. And that's very critical. We need to know that, the results of that, to be sure that, in fact, we're making the maximum use and effective use of our acute care bed capacity, because as we've said many times, if the acute care bed capacity is overwhelmed, then it backs up into our ability to flow through the emergency department, because now, in effect, we have patients admitted into the emergency department that are waiting to get up on the wards, and that is not a good thing because it causes congestion in the whole system. And going along with that, we're working very hard to find out better ways of moving and discharging our patients back to community. That means back home with home care if it's needed, or forward into long-term care or supportive living. So all of those actions are being very carefully looked into. And yeah, so, and I mean, I could tell you, I think it's improving, but I actually want to show you that it is improving as soon as I possibly can. And also get very specific about the specific actions we're taking on each of that. And I would say the same thing is true on our promise to reduce surgical wait times and the number of people that are waiting for surgery. So, yeah, within the next couple of weeks, we're going to have completed our work on that. And that's when, again, we'll reach out and call everybody together, and we'll be publishing our report on that. So the 90-day report's actually in progress. We're working on it. Many of my team are around me, and they're nodding yes. So that's what I would have to say on that.
Thanks very much. I think we have time for one more caller. Operator can put through the last caller.
Jenny Blaze, CHAH, My Radio.
Hi, my name is Janine Blaze, and I wanted to thank you for being forthright and bringing this information to us. It's been very helpful. I'm an intern, so I'm just starting out in media, so just be a little patient with me. I'm a bit nervous. I do have a question that had been brought up about the acetaminophen with the shortages. Are there other medications that are on shortage? Like I know of one that was in the last couple of weeks, but does the public know about that? And if there are shortages of other prescriptions, how does that go about that the patients and the doctors are made aware of that? Do they know that ahead of time? Or?
Yeah, thanks for the question, and good luck on your internship. We are tracking, and my understanding is that not only Health Canada, but in terms of working with the pharmacy associations in terms of challenges out there. It's acetaminophen, obviously, and ibuprofen, particularly for kids, and then even some of the adults' cough medicine. We know that there is a significant shortage. We are watching a number of other drugs that not acute at this point in time, but they're watching it with concern. And I can't get if you want to reach out to my office exactly, we can get you those items that we were watching. But it is primarily Health Canada, then working with the pharmacies in terms of what the demands are out there. I don't know, Dr. Blanche, anything to add?
The answer is that we, on the supply chain for, for our the medications and therapeutics that we need, it's constant work. And with the pandemic, there's been supply chain issues for the past 3 years. So we're managing this on a daily basis. I think you're probably referring to one of our cancer drug, doxorubicin, liposomal doxorubicin, that we experienced shortage, but we managed to mitigate that. So there's constant work in terms of optimizing a procurement in terms of drugs so that we ensure that we have a constant supply, and we work on a daily basis on that. Thank you.
Thanks, Janine. Do you have a follow-up?
Yeah, so like the medication that I'm talking about is probably, I would think, widely used. It was specifically Vyvanse for ADHD. And so I'm just wondering how you help the patients or the parents of the patients, if it's a parent of one, with navigating that.
Yeah, I haven't heard of an issue with Vyvanse, but our office is happy to look into that, and we can get back to you on any details on that. But no, that's the first I've heard Vyvanse being a challenge at this point in time.
Thank you very much. That's all the time we have today. Thanks for coming out.